Department of Public Health Director James Gillen is taking the lead on the implementation of medicinal marijuana on Guam.
It's here. We're gonna do it, and we're hoping that we're gonna do it right, and that people do get relief.
Last November, over 19,000 people voted yes on the legislative submitted referendum for medicinal marijuana. And on February 20th, it will mark 90 days after the Guam Election Commission certified those results, kicking into gear the official enactment of the law.
The latest development is that we're still working on the regs. We didn't even wait for the law to become effective.
The law requires public health to develop rules and regulations within 9 months from the enactment date, a task Gillen says has already started. But just because they are ahead of schedule, you shouldn't light up or start lining up for a license just yet.
I think there's a lot of people that misunderstand. They think that as soon as that act was certified by the Election Commission that it was already ready to go, because I even had somebody in my office on the 5th of November asking for, for marijuana. And I recently just had somebody come in with a prescription for medical marijuana. I had to caution the physician who wrote that Schedule 1 drugs you can't write prescriptions for.
An advisory board in the meantime has already been identified and will be tasked with helping public health, reviewing requests for medical conditions eligible to use medicinal marijuana and to determine the adequate dose to distribute.
2.5 ounces every 2 weeks is what we're looking at right now, but we'll have public hearings on the drafts, and we'll also allow the legislature is going to have a second look at this through the Administrative Adjudication Act.
But while he foresees the promulgation of rules to move quickly, he doesn't necessarily know just yet when distribution will actually begin. He has, however, researched just how many people will be eligible for medicinal marijuana.
I asked our Medicaid folks and our MIP and the 3 private insurance companies to give me an unduplicated count. Okay, so just the number of people who showed up to get seen for or treated for these conditions, and it's over 3,000.
He notes it doesn't mean all of them will come in for medicinal marijuana, but have medical conditions that may be eligible. More than a handful of proposed medical conditions are listed, including cancer, glaucoma, multiple sclerosis, and epilepsy. Reporting for Guam's News Network, I'm Ken Quintanilla.